Is global health in crisis or a necessary shakeup? The World Health Organization is facing a double blow as Argentina follows the U.S. in announcing its withdrawal. Are we seeing the beginning of a larger exodus from the WHOs? Or just two outliers bucking the trend? Echoing Trump's earlier move, Argentina's President Milei is taking his country out of the World Health Organization. Listen what Argentina has to say.
La participación de la Argentina en la Organización Mundial de la Salud, ratificarles que el presidente Milei instruyó al canciller W.H.O para retirar la participación de la Argentina en la Organización Mundial de la Salud. La misma se sustenta en las profundas diferencias respecto, por supuesto, a la gestión sanitaria, especialmente durante la pandemia, que junto al gobierno de Alberto Fernández nos llevaron al encierro más largo de la historia de la humanidad y a la falta de independencia frente a la influencia política de algunos estados. Los argentinos no vamos a permitir que un organismo internacional intervenga en nuestra soberanía, mucho menos en nuestra salud.
Both leaders from the far right share a common critique: the WHO's handling of the COVID-19 pandemic. Milei blasted the WHO's for its nefarious guidance on physical distancing, accusing the organization of a crime against humanity and blaming them for economic catastrophe. Argentina contributes roughly $8.257 million to the WHO's. Milei argues the funds are better spent elsewhere, giving Argentina greater flexibility to implement policies. But the World Health Organization isn't backing down. Director General Tedros is urging the U.S. to reconsider and stating, "We stand ready to reform." He also addressed concerns about the U.S. paying more compared to other countries. Listen what he said in recent executive meetings.
Ministers, dear colleagues and friends, as you know, 2 weeks ago, President Donald Trump signed an executive order announcing his intention to withdraw the United States from WHO. We regret the decision and we hope the U.S. will reconsider. We would welcome constructive dialogue to preserve and strengthen the historic relationship between WHO and the USA that helped bring significant impacts like the eradication of smallpox, and I can give you a long list. The executive order gave 4 reasons for the decision to withdraw from WHO. First, it says that WHO has failed to adopt urgently needed reforms. As this board is aware, over the course of the past 7 years, under the guidance and governance of member states, WHO has implemented the deepest and most wide-ranging reforms in the organization's history. The WHO transformation has touched every part of our work, our strategy, operating model, processes, partnerships, financing, workforce, and culture. We have also taken action on the recommendations of the Agile Member States Task Group. We have implemented 85 of the 97 reforms proposed in the Secretariat Implementation Plan on Reform, or SIP. And we are implementing the recommendations of the Action for Results Group led by WHO representatives to strengthen our country offices. For us, as we always say, change is a constant. And that's what our member states told us when we started the reform. Change is a constant. We believe in continuous improvement. And we would welcome suggestions from the United States and all member states for how we can serve you and the people of the world better. So although we are doing a lot of reform, but additional is welcome. Second, the order says that WHO demands unfairly onerous payments from the US out of proportion with what other countries contribute. Member states understand how assessed contributions are calculated. And you know, some countries choose to make higher voluntary contributions than others. Addressing the imbalance between assessed and voluntary contributions and reducing WHO's overall reliance on a handful of traditional donors has been one of the major areas of transformation. Because when we started the transformation, reliance on few traditional donors was identified as a risk. And we have decided then, 7 years ago, to broaden the donor base. Last week, the PBAC recommended the next 20% of increase in assessed contributions, and we asked this board to endorse that recommendation. This is a critical element of our long-term plan to broaden our donor base and will, over the long term, reduce the burden of financing from traditional donors, including the US. We therefore continue to seek the support and engagement of all member states, including the US, for our shared vision to put WHO on a more sustainable financial footing. Third, the order refers to WHO's alleged mishandling of the COVID-19 pandemic and other global health crises. Last week marked 5 years since I declared a public health emergency of international concern. On the 30th of January 2020, and at the time, outside of China, there were fewer than 100 reported cases and no reported deaths. On New Year's Eve 2019 and New Year's Day 2020, when much of the world was on holiday, WHO was not. I think you remember that. From the moment we picked up the first signals of viral pneumonia in Wuhan, we asked for more information, activated our emergency incident management system, alerted the world, convened global experts, and published comprehensive guidance for countries on how to protect their populations and health systems, all before the first death from this new disease was reported in China on the 11th of January 2020. Of course, there would be challenges and weaknesses, and there have been multiple independent reviews of the global response to COVID-19 with more than 300 recommendations to address the challenges or the weaknesses. In response to those recommendations, WHO and our member states have taken many steps to strengthen global health security, the Pandemic Fund, the WHO Hub for Pandemic and Epidemic Intelligence, the mRNA Technology Transfer Hub, the Global Training Hub for Biomanufacturing, the Global Health Emergency Corps, the Interim Medical Countermeasures Network, and more. So all this has been established based on the lessons learned. And as I mentioned earlier, member states have committed to concluding negotiations on the pandemic agreement in time for this year's World Health Assembly. Finally, the executive order says WHO has an inability to demonstrate independence from the inappropriate political influence of our member states. As a UN agency, WHO is impartial and exists to serve all countries and all people. Our member states ask us for many things, and we always try to help as much as we can. But when what they ask is not supported by scientific evidence or contrary to our mission to support global health, we say no politely. And you have seen me doing that many times. Before the US announcement, WHO is facing a shortfall due to the economic difficulties that many countries are facing. For many months, the regional directors and I, with the support of senior management, had been working with twin strategic goals: to mobilize new resources and to tighten our belts. The US announcement has made the situation more acute, and we have announced a set of measures with immediate effect to protect our workforce to the greatest extent possible.
Is this a genuine move towards national sovereignty, as Milei claims, or does it weaken global cooperation in the face of future pandemics? Global health increasingly precarious. Can the WHO survive these defections? Or is this a necessary catalyst for change? Let us know what you think in the comments.